Hey everyone, welcome back to my study vlog. Today I'm going through some assessment practice questions for the ASWB exam for licensed clinical social workers. If you're serious about passing your exam, I have an affiliate link in the bio. Here's a copy of it here. Although I would be recommending this product anyways, I do have to disclose that since this is an affiliate link, I make a small commission when you purchase through my link. It doesn't change the price for you at all, but if you're thinking about purchasing this product anyways, it's a great way for you to support the channel. And I'm always happy to tell more people about Exam Edge. They make it way easier to pass your licensure exam. A social worker at a community mental health clinic is conducting an initial assessment with a 35-year-old client. They are presenting with symptoms of anxiety, poor sleep, and difficulty concentrating. The client recently lost their job and has limited social support. Which of the following actions should the social worker take first during the assessment process? A. Explore the client's childhood attachment history. B. Develop a safety plan with the client. C. Conduct a biopsychosocial assessment. Or D. Refer the client for psychiatric evaluation. And the answer is C. Conduct a biopsychosocial assessment. The first step in the assessment process is to gather comprehensive information about the client's current functioning across biological, psychological, social, and cultural domains. This holistic approach ensures that the social worker understands the full context before determining next steps, such as safety planning or referrals. A hospital social worker is asked to assess a 72-year-old patient who was admitted for complications related to unmanaged diabetes. The patient appears disoriented, struggles to recall recent events, and has difficulty following the conversation. What should the social worker do first to assess the patient's mental status? A. Refer the patient for a neurological evaluation. B. Complete a mini mental state examination, MMSE. C. Interview the patient's family about past behavior. Or D. Conduct a substance use assessment. And the answer is B. Complete a mini mental state examination, MMSE. When a client presents with signs of cognitive impairment, the social worker should first administer a standardized mental status screening tool, such as the MMSE, to assess orientation, memory, attention, and cognitive functioning. This informs the need for further referrals or evaluations. During an intake session, a social worker meets with a 29-year-old client who recently immigrated to the U.S. and is presenting with symptoms of withdrawal, low mood, and sleep disturbances. The client speaks limited English and expresses concern about being misunderstood due to cultural differences. What is the most appropriate step for the social worker to take in the assessment process? A. Begin exploring the client's family history of mental illness. B. Proceed with a standardized diagnostic tool in English. C. Involve a trained interpreter and assess cultural context. Or D. Refer the client to a provider from the same ethnic background. And the answer is C. Involve a trained interpreter and assess cultural context. Effective and ethical assessment requires understanding the client's language needs and cultural background. Using a trained interpreter and exploring the cultural context of symptoms helps prevent misdiagnosis and supports culturally responsive care. Jumping to referral based on ethnicity alone or using tools in English without accommodation would be inappropriate. A 22-year-old college student meets with a social worker at the campus counseling center. During the session, the client states, "I've been feeling really hopeless lately, like nothing matters. Sometimes I think everyone would be better off without me." What is the most appropriate action for the social worker to take first? A. Recommend the client start journaling to process their feelings. B. Ask the client directly about suicidal thoughts or plans. C. Encourage the client to call a friend or family member. Or D. Explore the client's academic and relationship stressors. And the answer is B. Ask the client directly about suicidal thoughts or plans. When a client expresses hopelessness or implies suicidal ideation, the first priority is a direct risk assessment. Asking clearly and non-judgmentally about suicidal thoughts, intent, and plan is essential to determining the appropriate level of intervention and ensuring client safety. A social worker is assessing a 9-year-old student who has recently become withdrawn, is frequently tearful, and shows a sudden decline in academic performance. The teacher reports that the child flinches when approached and has started bringing extra snacks to school. What is the social worker's best next step in the assessment process? A. Refer the child for a learning disability evaluation. B. Conduct a play therapy session to explore academic stress. C. Report the concerns to Child Protective Services. Or D. Schedule a meeting with the child's parents or guardians. And the answer is C. Report the concerns to Child Protective Services. The combination of behavioral changes, fear responses, and signs of potential neglect, like bringing extra food, raises reasonable suspicion of possible abuse or neglect. Social workers are mandated reporters and must contact Child Protective Services before involving parents or proceeding with therapeutic intervention. A social worker begins working with a new client who reports low energy, difficulty concentrating, and loss of interest in previously enjoyed activities over the past month. To accurately determine the nature and severity of the client's symptoms, what should the social worker do first? A. Refer the client to a psychiatrist for medication evaluation. B. Administer a standardized depression screening tool. C. Explore the client's childhood experiences for contributing factors. Or D. Providing reassurance that the symptoms are likely temporary. And the answer is B. Administer a standardized depression screening tool. Effective assessment involves using standardized tools to gather objective information and guide diagnosis and treatment planning. Tools like the PHQ-9 or Beck Depression Inventory help establish symptom severity and are appropriate initial steps before considering referral or deeper exploration. If you're serious about passing the LCSW exam, check out the resources in my bio. As an affiliate, I do have to disclose that I make a small commission when you purchase through my link. This is an easy way for you to support the channel if you're looking for study resources anyways. Thank you for watching through the end. Please hit the like button if you found this video helpful, and hit the subscribe button so that you don't miss out when I post more videos just like this. Also, if you have the courage, let me know in the comments how you did on these questions. And I wish you the best on your journey towards becoming a therapist.